Okay guys, welcome back to another video, and today you can see I'm in my gloves because we're going to be doing something slightly hands-on and showing you a typodont, which is a model of teeth. And the purpose of this video is to teach you some basic skills on how to describe dental photographs. If in an interview scenario you're told to do this, you need to be able to give a description in a very structured format and also comment on the key features of the oral anatomy that you're expected to know. So we are going to give you a method and an approach to do this that you can apply to any set of teeth, whether it's a patient's elderly set of teeth where they've lost a lot of teeth, a child that has all their teeth newly erupted, or baby teeth as well. We'll talk about gaps, we'll talk about different tooth issues such as decay and gum disease, we'll talk about tooth wear, we'll talk about orientation. So these are some of the factors that we're going to be looking at. And you're not going to have my face in this video, we're going to be zoomed into a tooth model, and with that video you will get everything that you need to know about how to describe a picture station. And then what I want you to do is go online, search some pictures of some dental photographs and have a go at describing some of them. If you want, make a descriptive video, record yourself, send us the picture with the audio on Instagram at Medology Admissions or at Medology Global, and we'll listen to it and we'll give you some feedback. We are always open to help. All you need to do is reach out. But for now, let's get into the video. Okay guys, so this is a typodont model, and what it shows you is a view of the teeth. Now, if you're asked in an interview to describe a set of teeth, often the angle that you're going to get is a front-on angle like this. And the first thing to describe or tell the interviewer is whether you have an extraoral shot or an intraoral shot. Extraoral shots are shot from outside the mouth, so often you'll see the lips and then the front teeth like this. And intraoral shots are where you can either see the top set of teeth, which is called the maxillary teeth, and you'll have a view like this, or you could have a view just front on, and then the bottom set of teeth is called your mandibular teeth. And again, you can have an internal view, which is an intraoral shot, and if you see something coming from this angle, it's most likely to be an extraoral shot of the lower teeth, and that is your maxillary occlusal shot. So that view is an intraoral view. Now let's put the teeth back together and talk about what do you say after you determine it's intraoral, extraoral. The next thing to then say is the color of the photograph. Is it colored? Is it black and white? And what type of view is it? Is it a front-on view? Is it a side-on view? Comment on these features. After that, you can then go into a bit more depth. So you've now said it's an extraoral or intraoral view, it's a colored photograph. And actually another thing that's useful to say is your prediction on whether it's an adult or a child patient. Look at the age of the teeth, look at the size of them, look at the spacing between them. Generally, children's teeth are a bit more spaced apart and smaller and whiter, whereas adult teeth are a bit more aged, bigger, and they have that characteristic appearance and maybe a bit more wear on them as well if they're an elderly patient. So after that, you then need to talk about two things. You're going to focus on the patient's teeth, and then you're going to focus on the gum tissue as well. These are the two key things to probably put your focus on. And if there's any other soft tissues you can see, you can comment on them as well, such as the palate, the floor of the mouth, or the tongue. Now, the way we recommend you split the mouth up is into quadrants. Or the other approach, depending on the style of the picture you've given, is the upper arch and the lower arch. The maxillary arch and the mandibular arch is the technical term to use. Now, if we're going to go for quadrants, what it's important for you to do is tell the interviewer what you mean by left and right. Okay, so this side is the patient's left and this side is the patient's right. On a video, it becomes inverted. So you need to describe it as the patient's left or right. Okay, and remember that there's that inversion. So then you might comment on the upper right quadrant and first comment on the teeth. How many teeth are present? What are the color of the teeth? Are there any characteristic features of discoloration or decay? Are there any wear patterns? So can you see erosion or tooth-to-tooth grinding, which is called attrition? Look out for these sorts of features. Also, look out for gaps in the teeth. Why are there gaps present? Has the bone shrunk around the area? All good things to be commenting on. And you can repeat that you can repeat that same method for the other quadrants, the upper right, the upper left, the lower right, and the lower left. And another thing to focus on is the type of materials you can see within the teeth. If it's a heavily restored dentition, you might comment on that as well and say what colors of materials you can see. Are there white fillings? Are there gold fillings? Are there silver fillings? Are there natural tooth colored fillings? These are all things to comment on. Now, when it comes to the gum, you can make a general note of these, and you can look out for signs of redness, which is called erythema, signs of inflammation, or just sometimes the gums can be very pale and pink, which is healthy. Also, look out for the shape and the contour of the gums. Where teeth have been lost, often the gum tends to shrink down in that area because bone is lost, so you can comment on that as well. So those are all some features that you can comment on, and what it's important to do in this description is to not give diagnoses, but instead to comment on the descriptive features that you can see, because you can't actually make a diagnosis often from just looking unless it's tooth wear related. Diagnosis comes from a range of special tests that we do and special screening tools like the BPE or radiographs or other special tests such as cold testing, but you can't do that. So to make a diagnosis straight away is a bit immature, but you can say things that you suggest, such as tooth decay or bone loss or gum disease. And if you're very clever, you'll know the two different types of gum disease: gingivitis, which is limited to inflammation of gum tissue, and periodontitis, which is the point where we have clinical attachment loss and the bone around teeth starts to diminish as well. So hopefully those are some guides of things and pointers that you can say in your interviews for the questions around describing teeth. And hopefully that will help you out in your interviews. Okay guys, thank you for watching that tutorial. You're now equipped to go and describe any dental picture in some detail. Of course, we can go into hours about how to describe pictures, but that's not for now. You're going to pick that up at dental school, right? But if you enjoyed today's video, give us a follow, give us a like, and leave a comment as well. And hopefully we'll see you on our interview journey program or at one of our courses where we can get to know you a bit better. And like I said in the start, if you want to have a practice at describing some pictures, give us a message on Instagram. We're happy to hear your descriptions or your analysis written out and give you some feedback. Thanks a lot for watching, guys, and we'll see you next time. Cool.
Nice.
Cool.
Natural.